My name is Scott Harris and I'm a plastic surgeon in Dallas, Texas. I've taught plastic surgeons in London, Paris, Rome, Italy, all over Italy, all over France, all over England, and I've been in Dubai and Lebanon, teaching doctors about the lip implant and how to do lip surgery. What I'd like to do today is to talk to you a little bit about lip augmentation. It's a procedure that's been around for many years, and matter of fact, in the 80s, there was an explosion of a lot of different techniques that were used to try to get more fullness of the lips, and we still use a lot of those same techniques today because there hasn't really been anything until recently that has changed things. So the things that are used today include the following. There's basically only three. One is that we use fillers, which are generally hyaluronic acid types of things or collagen-like substances. And the cost for these range sort of in the $500 to $1,000 per session, depending on how much filling the patient wants or the person wants. So that and it also depends on if you're doing just the upper lip or if you're doing both the upper and the lower lip. So there's a range there that that exists. The second thing that's used is a fat transfer. So the fat is then taken from whatever area that the patient wants, usually the tummy, but it can be elsewhere. This is usually done awake under local anesthesia. And then the third procedure that's done is a lip implant. And a lip implant is, there have been several that have come along, but the one that has really, sort of withstood the test of time is the one by the company called Surgisil, which is a silicone implant that is solid. It doesn't, it's not a gel-filled implant or a water-filled implant, unlike the breast implants. And so it's a solid piece of silicone that does not require replacement. Once again, unlike breast implants, which are required, the FDA would like for patients to have those replaced every 10 to 15 years. So that lip implant, it runs in the around sort of high $2,000 or $3,000. That's sort of the range that procedure is. And that's done awake also under local anesthesia, and that includes doing both the upper and the lower lips. So what I think is just the smartest buy in terms of just if you're going to be spending money and you want to have a lip augmentation performed, to me the lip implant makes the most sense because, first of all, it's going to last you forever, and the fat may not, and the filler definitely does not. And basically when I sort of looked at this, I figured that a woman could have a lip augmentation done with filler or fat sort of like 2 or 3 times, and essentially have, or for let's say 2, 3, 4 times, and they could have paid for a lip implant that would have been good forever. So to me, there's a lot of cost benefit in doing the lip implant. Now, I probably am a little bit biased about the lip implant too, because I was the co-inventor of the lip implant. The lip implant is basically, it's a silicone tube that is then tapered on each end, and that comes in a lot of different sizes, specifically 9 different sizes, and but they're all generally the same shape. And I think it is, it's not the perfect procedure for everybody. I wouldn't go so far as to say that. And one of the nice things is that you can also put filler in addition to having the lip implant. But the best thing I think about the lip implant is that it's the only procedure that is done on the lips in which can be completely undone. So it's completely reversible if the patient doesn't like it, or it can be, you can put in a smaller one if you want to downsize, or if you want to upsize, you can go larger. It's got a lot more ability to change, or much like breast implants. You can switch out breast implants, if you want to be a little bit, you decide you want to be a little bit bigger or a little bit smaller. So it's my favorite way to go. Now, some people aren't ready to have the silicone, and so we still, even in our office, we do a lot of filler and fat transfers. So that's my take on lips.
Fresh Image Center. Do something good for yourself.
Fresh Image Center. Do something good for yourself today.